Hello, good people. Hello, family. Hello, my ladies. Good morning, good afternoon, good evening, wherever this may find you. Today is March 30th. March 30th. One more day to go. March is Women's Month, and the whole month of March, we'll be talking about women mental health issues. Okay, it's not to say that there are not other things affecting women, or these issues or conditions that we talk about do not affect men, but we'll focus more on women this month because March is Women's Month. And from this month of March, we have looked at different conditions such as mood disorders, depression, anxiety disorders, eating disorders. And this week here, the last week of March, unfortunately, we only have like 2 days to the end of the month. So these 2 days, we will use it to our advantage and explore the best we can. This doesn't mean that this is going to be the end of us talking about these things, but we're going to talk about these things in general and how it affects the general public. But this today is especially geared towards women. This week here, or these last 2 days of March, we are going to look at neurobiological conditions in women. Okay, we're focusing on women. Again, doesn't mean that these things do not affect men, but women, it's a little different how these things or these conditions affect them. Neurobiological conditions, these are conditions that affect the brain structure, the function, the chemistry, and this also would influence cognition, behavior, and emotions. Neurobiological conditions that I'm talking about, they affect the brain structure, how the brain functions, the chemistry of the brain, and it will influence cognition, behavior, and emotions. These conditions, like I said, they occur both men and women. But for women, due to hormonal fluctuations, genetic factors, and social influences, it makes certain neurobiological disorders more common, or they present themselves very differently from men. When we talk about neurobiological disorders, we're looking at ADHD, or attention deficit hyperactivity disorder, autism spectrum disorder. We're even looking at anxiety disorders, depression, and other mood disorders, PTSD. These are all neurobiological conditions because remember, what did I say they do? They affect the brain structure, function, and chemistry. All right. And we're also going to look at multiple sclerosis. But because we've already talked about the anxiety disorders and the mood or depressive disorders, these 2 days here, we're going to focus mostly on other things such as ADHD, ASD, that's autism spectrum, and MS, or multiple sclerosis. So ADHD, or attention deficit hyperactive disorder, um for women, is oftentimes goes so undiagnosed, and this is because there's a lot of internalized symptoms. Women, they internalize these symptoms, they don't express it. Inattentiveness and disorganization is rather more common in women than hyperactivity. Not to say some women are not hyperactive, okay, they can be very, very hyperactive, but most of times it's so internalized that these symptoms are not even observed. When it comes to ADHD, they say you want to be diagnosed before the age of 12 or by the age of 12. But for women, because they mask these symptoms, it goes well into adulthood, where some people even in their 40s and 50s before it's coming out. It's like, oh, this is serious. Symptoms may worsen with hormonal changes, especially during puberty, pregnancy, and menopause. So as your hormones are fluctuating, so these symptoms may be worsening. Women with ADHD, they have increased risks of anxiety, depression, and low self-esteem due to societal expectations. So how many times is a woman suffering from ADHD being diagnosed or misdiagnosed as anxiety or depression and even bipolar sometimes, and they're treating you for all these things, and the main culprit, which is ADHD, is not being addressed. And with ADHD, when today I'm just giving you a general synopsis of these disorders. Tomorrow we'll try to break them down some more. But treatment for ADHD is usually stimulants or non-stimulants, and you have therapy, especially CBT, and executive function coaching, because ADHD is an executive function disorder. Okay. Now, the next neurobiological disorder we're going to look at is autism spectrum disorder. Autism spectrum disorder for women, we're looking at it for women from the standpoint of a woman. If you are a woman, if you have a sister, if you have a mother, if you have an in-law, if you have a wife, if you have a cousin, if you have um a grandmother or a mother, this is what you really want to pay attention to. Women with autism spectrum disorder, they often develop better masking skills. Okay, so this lead to their diagnosis are not, they're not diagnosed earlier. It's usually until later in life. Then you begin to see, I've seen a lot of people later in life in their 20s, 30s, and even 40s. Then they say, oh, I just got diagnosed with autism. So symptoms sometimes is social exhaustion for women. They have this social exhaustion, very, very intense sensory sensitivity. They're so sensitive to any sensory stimuli, intense spatial interest. So they focus with some things that their interest is so high in there. It is, of course, very common that it occurs with other mental issues such as anxiety, eating disorders, and PTSD. Again, these are the masking. So because they're having these ASD symptoms, they mask it, they portray like it's anxiety, it comes out like it's an eating disorder or PTSD. Again, treatment, we've talked about this. Treatment for autism is usually behavioral therapies, where you have CBT, that's the cognitive behavioral therapy, or social skills training, sensory integration therapy, and support groups. Also, if you have co-occurring anxiety, PTSD, and other symptoms, medication could also be necessary. There is no specific medication to treat autism. We treat the symptoms. So do not get me wrong, my ladies, okay? We treat the symptoms. Autism is a whole spectrum of symptoms. Now, the other neurobiological condition that we want to focus on here is multiple sclerosis, and then we'll go to Alzheimer's. Multiple sclerosis is an autoimmune neurobiological disorder. It affects women 3 times more than men. So for every 3 women, then you may have 1 man. That's what that means. And the symptoms could be fatigue, vision loss, of issues with sight, numbness, and some cognitive changes. It worsens during postpartum and menopause period. So this is due to estrogen fluctuations. Okay. So again, the treatment is disease modifying therapies, physical therapy, and symptom management. Just like autism, multiple sclerosis is usually symptom management. Okay. And finally, we're going to look at Alzheimer's and cognitive decline, such as dementia. Alzheimer's, of course, women are twice as likely to develop Alzheimer's due to, of course, women have longer lifespan, and then estrogen protective role before menopause. You see, everything has its place. Estrogen is protecting your brain before menopause. And then symptoms may be memory loss, confusion, difficulties with reasoning, and problem solving. So, what is the treatment for Alzheimer's? Of course, it's usually therapy, CBT, lifestyle modifications, and then medications as needed. Okay. So, my ladies out there, I'm coming to you from Bethany Health Services, Dr. D, just to talk about these neurobiological conditions. And then tomorrow, we're going to focus more on mostly ADHD and autism, okay, mostly tomorrow. But what I want to leave you today to tell you that this neurobiological condition, they are not unique to women. They are not unique to women, but women have different presentation and different symptoms. And this is mostly influenced by hormones, genetics, and life experiences. Okay. When it comes to neurobiological conditions, successful treatment is early diagnosis, therapy, and lifestyle adjustments. Remember all those things we talk about, the things you can do to adjust your life. Exercise, you want to exercise. I cannot stress this enough. You want to include some vitamins, especially the B vitamins. Those are good for cognition. So you need to start doing things to prevent these things and delay onset, and to even enjoy a good quality of life, even if you have these things. It doesn't mean that somebody with ADHD cannot have a good quality of life, or autism cannot have a good quality of life. And even somebody with Alzheimer's disease, you can modify things and still have a good quality of life until when it is the end of life. So this is where we come to say you have to take care of you as a lady. You need to make sure you have self-care tools, self-care practices that will maintain your physical health, your emotional health, your psychological health, and your overall well-being. Because when you do that, you take care of you. As you take care of your body, you want to know that that body is beautiful. And I want to leave you today to say you are gorgeous, you are beautiful, you are most talented, you are the most beautiful human being on planet Earth. Look at yourself like that. For I am one, and I hope you are one. Be one of them. Get the confidence you need. It does not matter your shape, it does not matter your size, it does not matter your skin color, it does not matter your background. It doesn't matter where you're coming from. As a woman today, I want to tell you, take care of you, be beautiful, stay beautiful, keep a smile on your face no matter what. For what it says, it takes less energy to smile than to frown, and it's youthfulness that will rejuvenate in your presence. Make your presence known. Make your personality known. Be who you are. Do not let the world, do not let TV, do not let social media, do not let anyone else determine your happiness. Your happiness is yours, is for you. Have that inner beauty so that when the inner beauty is there, it will radiate on the outside. And I tell you this, you will feel good. So go out there, take care of you. I will see you tomorrow. Like this video, share it to your friends, share it to your family. Let them come to know that as a woman, you've been blessed to be a woman. It is a special attribute, it is a special character, irrespective of all these disorders are related to hormones fluctuations. But sometimes those hormones are protective. Think about the estrogen protecting us before menopause from Alzheimer's. So those are some of the things that is why women develop it later in life, and women also are the ones to develop it because they live longer. So go out there, take care of you, and be blessed. If you need to reach us at Bethany Health Services, 603-601-4766. 603-601-4766. If it's online, you can reach us at bethanyhs.com. Bethanyhs.com. If you are in crisis, I'm in crisis, and you need to talk to a mental health counselor 24 hours a day, you need to dial 988. Dial 988. Somebody is on that line, and you can call that number for your loved ones. It does not have to be you that is suffering. Anyone can call that number, 988. Okay. And if you need to get yourself to the emergency room, go do that. Take care of you. It's only you that can take care of you. While we support you and we uplift you, I pray that you'll be uplifted today and remain blessed. Thank you for watching, and I see you around.